cervical smear and the results. So your pap smear report showed atypical squamous cells of undetermined significance or ASCUS. If you see, normal results come like this, negative. It didn't come like that. These are abnormal results, but no need to be worried. But if you do see the spectrum, this is the first abnormality. It is the mildest abnormality, atypical squamous cells of undetermined significance. Now they are saying it's undetermined significance. It means they don't even know what's the significance. So what's the second step? Second step is to check whether it is really significant or not, and that how we do it? We do it by HPV testing. I'll just show you here cervical smear results. Okay, see, ASCUS. So ASCUS stands for atypical squamous cells of undetermined significance. So what we do HPV testing. If your HPV is positive, then I will offer you some other testing, that will be colposcopic biopsy. What is colposcopic biopsy? बिल्कुल pinhead के size का जो वो होता है tissue. We take it like a pincher होता है, and we take it just in the clinic. We take a pinch of it and we send it for histopathology to see whether it is significant or not. But if you see the whole spectrum, in the whole spectrum, ASCUS is the mildest abnormality, and science still doesn't know it does have significance or not. So उस significance को determine करने के लिए we do the HPV testing. If HPV testing comes positive, then yes, you need the biopsy. If it comes negative, you don't need anything. So that will be the next step. And since, you know, if I would have told you this, the word biopsy on telephone, you would have freaked out. You would have been panicking, and you know what? It's a mildest thing. In the word undetermined.
मैम थोड़ा उसको नॉर्मल लैंग्वेज में क्या बोलेंगे?
जैसे मैं उसको बताती हूँ उर्दू में. सही है. एटिपिकल मतलब सेल ऐसा जो माँ बाप की शक्ल का नहीं है. टिपिकल मीन्स माँ बाप की शक्ल का. एटिपिकल मीन्स तो वो जो उसका पेरेंट खलिया था, जो उसका माँ बाप सेल था, खलिया था, उसकी शक्ल का नहीं है, एटिपिकल सेल है. बट साइंस को नहीं पता कि ये वाकई अच्छी तरह से नॉर्मल है या नहीं है. और अनडिटरमिन्ड सिग्निफिकेंस के अभी तक जितनी साइंस की तरक्की हुई है उसके मुताबिक इसका कोई वैल्यू भी है कि नहीं है, क्योंकि हमें नहीं पता. तो हम एक एडिशनल टेस्ट करते हैं कि चलो दूसरा टेस्ट करके देख लेते हैं कि वाकई एबनॉर्मल है कि नहीं है, और वो टेस्ट का नाम है एचपीवी. और एचपीवी से हमें पता चलेगा.
तो
अगर
कैसे होगा एचपीवी?
सेम वे. Yeah, exactly. For you, there's an additional step. अगर HPV negative आ गया, कुछ नहीं करना. Forget about it then. सही है ना? So for you, still there's a step. Then we'll decide whether we have to do biopsy or not. Even वो biopsy जो होती है, it's a very tiny one. It's not a big one. ठीक है ना? Today I will explain if your pap smear result shows atypical cells of undetermined significance, ASCUS, ASC-US. Let's get started. When you get report of ASCUS in your pap smear, it means your cells are slightly abnormal. They are not diagnostic of precancer disease, but it means that you need further evaluation, and it is very common. What causes ASCUS? Causes could be many, and it could be infection, it could be due to HPV infection, it could be due to yeast infection, or it could just be due to inflammation, and it could also be due to hormonal changes. It just doesn't mean that it is precancer disease, but it means that you need further evaluation to know why it is happening. Once you get the report of ASCUS, the next thing is what needs to be done. There could be multiple options. First option, that you can just repeat the same pap smear again in 6 months or 1 year, especially if HPV testing is not available. But if HPV testing is available, you can do HPV testing and it comes positive, then you need colposcopic biopsy, which is taking a pinhead size of the tissue from your womb neck, which is called cervix, or if HPV comes negative, then nothing has to be done and you can go back to regular screening. But all the steps depends on your age and depends on what was your previous pap smear. Most important thing after you get the report of ASCUS that you have to adhere to the follow-up. Whatever your gynecologist advise you, you have to follow that up. Thanks for watching. Take care of your health.